Hey guys, it's Marshall and Ann with PhysioU. In today's Mentoring Minute, we'll be talking about impaired lumbopelvic control. There's an article that took about 100 patients, half with and half without chronic low back pain, and looked at two limb tests. They looked at prone knee bend and hip external rotation, hip lateral rotation in prone. And what they found was in the chronic low back pain group, they found a decreased knee flexion angle compared to the controls, with more lumbopelvic control or lumbopelvic rotation, and it occurred earlier in the knee flexion angle. They found similar results with the prone lateral rotation. As the patients externally rotated their hip, not only did they have less hip external rotation, they had more lumbopelvic rotation, and it occurred earlier in the movement. Right? So they found similar results for both of those movement tests. In another article that looked at quadruped, we're going to come up on the hands and knees. Okay. They used that same prone external rotation test, as well as they used a different test, just lifting up one arm and looking at how much lumbopelvic rotation occurred. So they were measuring controls versus painful patients. And again, they found similar results. About 41% of patients with low back pain, patients with low back pain had about a 41% increase in lumbar pelvic rotation compared to the controls. Go ahead and lie prone again. So again, 3 different movement tests that we can utilize. Prone knee bend, prone hip external rotation. Again, these are both passively but actively done by the patient. So go ahead and flex your knee and looking for motion. And then start at the 90, and you're going to externally rotate. Bring your heel towards me. Again, looking for lumbopelvic rotation. So those 2 plus the quadruped one, that makes 3. Those are 3 good movement tests that research supports patients with chronic low back pain versus patients without. The third article looked at, well, can we change that? So they had, two groups. One group that got very specific treatment for lumbopelvic rotation control. So they worked on abdominal bracing with these movements, trying to make the patient really aware of their lumbopelvic region, not letting them rotate, only moving in the extremity. Versus the other group got normal physical therapy. And nice thing was the group that had the specific training not only decreased their lumbopelvic motion, they also increased about 10 degrees of hip external rotation from when they started. So the nice thing was not only did it improve hip mobility, it improved trunk control as well. All right, thanks again guys, and we'll see you next time.